Hello and welcome to Washington Exec's video series. I'm your host, Amanda Ziadeh, and with me today is Liz Porter. She's the Health Group President at Leidos. Thank you for being here, Liz.
Thank you for having me.
Of course, so we're here to talk about holistic health and what that means for Leidos internally and with its customers. There, of course, isn't a more important topic at the moment, so it's great to have you here. So I want to start by asking, what does holistic health mean for Leidos and Leidos Health?
When I think about holistic health, you start to think about beyond, a lot of people think of health as the physical, and holistic health really is beyond that. It's mental, it's financial, it's your family. When we think about this time and everything that's been going on in the pandemic, you think about all of the stressors that you're used to when you're normally working in the workspace, but beyond that. And so when Leidos is looking at holistic health or looking at holistic health for our customers, it really is that bigger picture. I even think about it from when we talk about diversity and inclusion, we talk about people bringing their whole selves to work. It's that same concept. It's whatever else is influencing an individual that can impact their health. And that could be anything that is not just specifically a health symptom, but could be a financial impact. It could be, what they're dealing with at home and how they're juggling all of that.
That makes sense. So how has Leidos helped its employees adapt to the pandemic work arrangements?
I'm really pleased with a lot of the things that Leidos looked at and attempted to do during the pandemic. Certainly, along with many companies, we really upped the game on our communications. But beyond that, again, looking at the broader impacts of the COVID-19 pandemic was looking at what did it mean for employees that were working from home, that were now facing these additional stressors. Whether it's taking care of an elderly parent, or it was taking care of children, or just trying to work at home in a small space with another individual, whether it was a spouse or a significant other, or in my case, I have my dog at home, and trying to juggle all that and looking at, if you start early in the morning on meetings and you're ending late at night, what does that do to the individual? So we were looking at ways to help out. And so we looked at first the mental health aspects, and certainly we're worried about reaching out to those employees and increased our engagement and increased the informal engagements we were having to make sure we had check-ins. And then on top of that, we also looked at what were policies and processes that we could put in place that would help them out. And so we established a caregiver forum. It's an area where individuals who were caregivers either to parents or adults as well as to children, to be able to share ideas, to be able to share tips and techniques, or even just to vent in some cases and be able to have that outlet. And then we also looked at increasing some of our benefits. So we did provide some pandemic sick leave. We also looked at adding to the ability for individuals to get in-home care for their children, especially if they were dealing with working while trying to have children do classes, or even just taking care of children on a daily basis. And then really looking at different ways to help with the mental stresses and other things related to behavioral concerns or mental health concerns. And so specifically looked at enabling and giving all of our employees the Headspace app, which is an application that you can download for free, but we gave them access to broader capabilities that included some of the the meditation and other aspects. And then we also have an employee assistance program that they had access to, that in case they needed that more confidential counseling, to ensure that we were reaching every employee.
So how does holistic health apply to your customers?
So when I think about our customers, and actually I'm a military spouse, and we do a lot of support for our military through various programs. They're also looking at holistic health. So the Department of Defense has their Total Force Fitness approach and program, where they're looking at the physical, the financial, the behavioral, the mental. And so certainly in those cases, we support the military today with some research and development that looks at how are they approaching bringing together all of those aspects and identifying ways to help the military service member. If I think about, the beginning of the pandemic, my husband was actually stationed in a different state, and which was not a problem to begin with when he was first assigned there, but then the pandemic hit and we weren't able to travel. And I thought about all of the military spouses that had that happen to them, and maybe their spouse was overseas, or they were at home with children, or at home with others that didn't have that access, and the stressors that they felt. And so certainly looking at one of the areas we're hoping to support is in non-medical counseling. There's a military family life counseling contract that we're looking at providing that type of capability, and then even expanding beyond that and looking at the physical stressors and the financial stressors and how those play into how a military service member performs, and what we can do to provide better capabilities to understand what those are and relieve those stressors.
Definitely makes sense. So my last question for you is how does Leidos look to enable customers in holistic health, and what are some ways in which Leidos is supporting holistic health for their customers?
So as I mentioned briefly, we are doing some of the research and development today, and that looks at impacts like how long can a Navy SEAL stay in cold water without them feeling the physical effects of that, or what they can do to prevent those physical effects. Going beyond that and looking at implementing things like artificial intelligence and machine learning, we really want to look at how do you analyze that continuum of data that looks at not just the physical fitness, the mental fitness, the financial fitness, and be able to start to predict and look at what we can do to adapt and provide that optimization to the military service member. And they're really looking at what does that mean for personnel readiness. So if I'm a military service member and I'm overseas and I'm focused on trying to do my job, I want to know that my family's safe. I also want to know that if I'm working or I'm out in the field, that the stressors that I have out there, that I've got the right type of equipment to ensure that I don't injure myself. And so it's applying technology in a way that would help us look at what does that mean and how we can guide the senior leadership to make changes, and even look at an optimization of that service member's career in a physical fitness way as well as in a mental fitness way.
Right, definitely. And thank you for joining us. This was a very important topic to talk about, especially right now. So I appreciate you being here.
Wonderful. Well, thank you for having me, and happy holidays.
You too.